Shanghai is expanding its COVID lockdown amid a surge of cases. Cases are now up by a third. This is despite the stringent measures already in place to stop the spread of the virus.
Millions of people in Shanghai have to participate in mandatory daily COVID testing to keep their QR code passports valid. Refusal of testing is a criminal offense that could lead to prison. Zero COVID craziness. Yeah, I mean, how many more examples do you want of reasons that I don't want China to be in charge of the world? Like, I think the U.S. response to COVID was too crazy. And the U.S. was by like the least totalitarian, maybe not the very least totalitarian, but, is toward the less authoritarian than side of things, and certainly less than China. They're still doing this. They're still locking people in their homes. They're going to have to do this forever because so they let them out, they're going to succumb to whatever variant the rest of us have agreed to live with.
I think the problem for China that they're dealing with, because clearly, I mean, much of the world has given up on zero COVID, right? They're like one of the last holdouts on this, and I think their problem is that inside of the country, their narrative was so strong on this. They just kept pushing it, like we can defeat COVID, we could keep it out of the country. And they pushed it so hard, and they pushed the people so hard that they cannot easily give it up. Yeah. Because if they do, if they flip like that, then it will lose, the public trust.
And they treat it like a moral failing if you do get it. It's because you're a bad, unclean, unpatriotic person.
Sounds familiar.
Yeah.
So I don't know, but this is not sustainable. I mean, maybe they could kind of ride this out for a couple of years where they sort of do this and then cases, and then they kind of get to the point where I think many here in the United States did, where it's, many that were zero COVID here have now kind of come around to, well, like even Dr. Lena Wen, right, on CNN,
right,
where they're like, well, okay, now, the virus is everywhere. It is what it is. So maybe after, I don't know how long that will take, though, for the government and the people, even the people, because they've been told this for the last
we have
years.
Extreme political competition, though. That's part of the reason. I believe that Dr. Wen and a lot of other people in the sort of Democratic policymaking side, they saw poll results. They said, man, keeping masks on kids and forcing all that, we're going to get killed forever.
Right.
We got to get. It's time to give this up. And that's when you saw the difference. It was like a 10-day difference between attacking Youngkin for being done with masks to embracing, New York and New Jersey and everyone else for letting masks go in the media.
Yeah, so a good point.
But in China, they don't have that effect because there isn't political competition, is what I mean.
And I think, I think one thing China has said that they're going for is they're trying to stall this long enough that they can build a lot more hospital capacity. And by hospital capacity, like throwing up cots and very basic stuff that which we did in the very beginning. We turned in D.C. I don't know if it's still called the Verizon Center, the basketball arena. That was going to be a giant field hospital. It ended up Capital One Center, apparently. Got to give our proper corporations their credit for what they paid for. Just called a basketball stadium. We never ended up using it. I'm sure they would have not liked have their corporate name after a bunch of people dying on cots inside of it. But
really.
So I think a lot of this goes to hospital capacity. Like and when you're at capacity, the restrictions start to make a lot more sense.
Right. And so maybe they are, I mean, right now they're not reporting any deaths. They have a big spike in cases, but then again, their spike when you look at the wave is, it's a little early. And so the deaths usually come a couple of weeks later. But one thing about China that's interesting with hospital care, they're at a bit of an advantage in a way in that they have a different culture when it comes to nursing for the patients. A lot of it is family members. So family members, when you're hospitalized, your family is expected to come and care for you in a way that a nurse here in America would. So your family is the one that feeds you, changes you, helps you out, bathes you, and watches you, and then alerts the doctor if there's something. Now with COVID, it might be a bit different. I know that they were trying to isolate people quite a bit away, and that was a very different thing for the Chinese. So we'll see if so that's maybe that's where it gets a bit complicated for them, is like, but then they'll just maybe give them bubble suits, right? Like go in there in the full, that what we've seen. But they got to give this up. I mean, the world has to give this up. But I understand you also don't want to have that wave into the hospital. But they've been vaccinating like crazy. So
right. Right, they're going to have if they just let it ride, you'll have an increase in cases. You won't have as long as the vaccines they're work as well as ours do. They will likely not have a spike in hospitalizations and deaths. We've not seen that. Europe hasn't seen that. It's cases no longer matter that much. So it's
to hospitalization rates.
Right.
Yeah.
Right.
Yeah.
Yeah, gotta let it go.
I think that
See how good their vaccine is too. Like we don't necessarily know how.
Well, we've seen it. Well, it's been all around the world. I mean, they've exported it plenty of places.
How's it competing against the other ones?
I mean, it's about it looks to be roughly similar.
Like J&J level.
I haven't actually looked at the latest data on the Sinopharm stuff, but I think it's similar when it comes to death rates, preventing death, and it wears off, so you have to get it re-upped and that kind of thing. But I think what the world is really watching with China is how this is going to affect our supply chain. I think that's the real issue. This is going to affect the supply chain. Will the rest of the world then kind of panic again and start doing lockdowns again as it waves through and around the world? Are we in for it again or what? And I think that is, that's the big issue. The supply chain problem, I think, could be devastating for us here in the West.
Yeah, it's something to watch out for. Well, we'll be back with more Rising right after this.